the Pet Dental Center in Bonita Springs with Rita. If you've been following her saga, she had some heart issues starting up that were probably related to some dental issues. So she had dental surgery about 2 weeks ago, and today Denise is going to show us how to do a proper toothbrushing.
Hi. Brush is great for medium dogs. It might be a little bit big for Rita, but the way that it works is when you push it up against the tooth, the bristles splay out and it can actually get up underneath the gum line, which is where the bacteria sits that causes periodontal disease. Now this isn't going to be an option for everybody because there's going to be some smaller patients. So this little toothbrush is great as well. And this one will splay out too. So this will probably be good for Rita, or at least a good option. So we can see that one splays out on the tooth as well, and we can get up underneath the gum line. These I like for kitties. With this one, we just have to get the tip of the brush in the mouth. So if this was a little kitty, we'll use this little skull here. So if this was the kitty, all we have to do is get this up underneath the lip and brush the teeth on each side. So we don't have to try to get this big fat toothbrush in the cat's mouth or a small dog. And then the last option is this little finger brush. And this one is probably going to be great for Rita as well. And this, same thing, put it on your finger, slide it underneath the lip. And again, we can get in there because that tip is not fat, so we can get in their tiny little mouths. One that is the last resort is this finger brush. Because this you have to stick on your finger and then you have to try to get your whole fat finger in the little animal's mouth. And it's also little plastic nubs, so it does not splay out and get up underneath the gum line as much as we would like it to get that plaque bacteria out of there. So these are the different options. And then of course we have giant toothbrushes for bigger dogs as well that are double-ended. But these are great for our small patients that we see that have periodontal disease.
Go ahead. Hi, I'm Dr. Gingrich, and I'm here today to recheck Rita after her dental surgery, oral surgery. And it looks like things have healed up great. She is looking great. She doesn't have any more bad breath. And from this point forward, the focus is going to be on brushing her teeth and making sure that we can prevent any periodontal problems in the future. So we're going to focus on that and then probably see her back for a recheck in the next 3 months and see how things are going at home.
And hang on to her just like this, and you're going to come in from the front, okay? So let's see how she does with this without anybody hanging on to her. So kind of like how I showed you on the model, I'm just going to hold her mouth closed a little bit. Yeah, and she's going to scoot backwards. And I'm just going to slide under her lip. And this is nice because we don't have to get that all the way in there. Good job. Good job.
She's loving that.
Oh, what a little doll. And see, I can feel that I'm on the teeth.
Yeah.
What do you have on this side?
She's missing her fourth premolar
Okay.
on that side.
There, we're on the bottom teeth there.
Yeah.
So she's going to move a little bit, but I'm going to move with her. I'm not going to like try to keep her absolutely still. And that canine's gone. There, good job.
Doing real good.
Good job, little peanut.
Excellent.
So now, as you get used to it, you can increase the amount of time that you're doing, okay? But in the beginning, we want to start slow so she doesn't overreact to it or take it as a negative experience. And I didn't use a toothpaste today because I don't want her to associate that with being here and being nervous. But if she's food motivated, that's a great reward-based treat. So this is perfectly edible for her. So you can put that on the toothbrush, let her lick it off, get used to it, do a couple teeth, increase the amount of teeth that you're doing. You don't want to use human toothpaste because the fluoride in that is toxic to their kidneys and they swallow it, they don't spit it out. So always use pet toothpaste. Or no toothpaste. You can just use the brush and actually mechanically take the plaque off. That's it.